Good morning, everyone. Welcome to another edition of United Way for Southeastern Michigan's What's the Word Wednesday, where we share important resources and have vibrant discussions about topics that matter most to you. My name is Shayla Zimmerman, and today we are continuing our Equity Challenge series of What's the Word Wednesday town halls. By discussing how we all embrace equity and can embrace equity from leaders across nonprofits who took part in developing content for our 21-day equity challenge. Before we dive in, a quick reminder for our audience. Closed captions are enabled in Zoom and Facebook Live. To turn them on, please click on the Show Captions button at the bottom of your screen. For those of you who have been participating in our 4th annual 21-day equity challenge these past 2 weeks, you may already know that we've teamed up with our nonprofit partners, including our panelists today, to curate content for this year's challenge. Today, we'll be joined by 3 amazing community group partners who dedicate their work towards elevating diversity and creating more equitable communities for everyone. I'd like to introduce our 4 panelists for today. First, we have Dawn Espy. Dawn is the Director of Consulting at N.E.W, which is the nonprofit enterprise at work. At N.E.W, a nonprofit that builds capacity for other mission-driven organizations, Dawn balances their time between supporting a team of consultants and working with the community. As a consultant, Dawn loves supporting people and organizations as they grow and access their full potential. Before N.E.W, Dawn spent nearly a decade working with youth experiencing housing instability and educational inequity. In their free time, Dawn is a fan of sports, and if there's something big sports happening, especially Michigan football, go blue, Dawn is following along on their phone or TV. Welcome, Dawn.
Thank you. Hi, how are you doing?
Good. Welcome. All right, next up we have Maggie Perry. Maggie is the Vice President of Operations at Community Housing Network. Community Housing Network is committed to providing homes for people in need through proven strategies of homelessness prevention, housing assistance, development of affordable housing, community education, and advocacy. As the Vice President of Operations, Maggie is on a heartfelt mission to make a positive impact on the lives of those in need. Starting as an executive assistant in 2012, Maggie had the privilege of witnessing Community Housing Network's growth from every angle. At the heart of Maggie's role, she is dedicated to fostering operational excellence and nurturing the well-being of exceptional employees. She also embraces the responsibility of leading the creation and implementation of strategic initiatives that drive their mission forward. Welcome, Maggie.
Good morning. Thank you so much for including me today.
Thank you for being here. And next up, we have Sharron Fincher. Sharron is the Access, Equity, and Inclusion Coordinator at Avalon Healing Center. Avalon Healing Center assists individuals who have been sexually assaulted, including individuals of all genders, ages, races, and religions. In Sharron's current role, she works closely with marginalized populations who have experienced sexual assault and trauma, and she is spearheading a new DEI program at Avalon. She is a native Detroiter and a graduate of Detroit Public Schools. She attended Wayne State University School of Social Work, go Warriors, and has been involved in the community for over 25 years. She sits on the board of directors of the Ruth Ellis Center, where she is the board chairperson, and she is a member of the Detroit Police Chiefs LGBT Advisory Board. Sharron was recently awarded the 2023 Vanguard Award by the Detroit Choice Awards for her work with the LGBTQ community. Thank you so much for joining us, Sharron.
Hey, everybody. Thanks for having me.
Thank you. Welcome, everyone. Thank you so much for being here. It's such an honor to be in a space with 3 incredible leaders, and we appreciate the work that each of you do in our region. Let's get our discussion started. So as leaders within the nonprofit, social services, and community spaces, what inequities are you witnessing and injustices are you witnessing within those spaces? Dawn, do you want to get us started?
Sure. Yeah, so I think, as you were mentioning, I've spent time working in direct care work over the years, and then also in my personal life, just invested in our community. And ultimately, what I see a lot of is, I mean, are these inequities and disproportionate experiences that occur for folks who hold marginalized identities. Often it is the issue to me is that the folks who are working in nonprofits don't really reflect the populations they're serving. And so that becomes difficult because ultimately, not that lived experience is the only way to understand someone, but it does have an impact on how you show up. Being able to show up in trauma-informed ways, in healing-centered ways, is really important. One of the things that oftentimes shows up in terms of an inequity is around things connected to if you've been connected to the carceral system. If you've had any interaction there, it often prevents you from being able to get housing. It often prevents you from being able to get jobs. And it ultimately, it impacts a number of people in our community. And yet those folks are left out of a lot of the process. And it's really difficult to create restorative practices when the laws are set so that people aren't able to reintegrate into society. Right. And so that's something that I'm really passionate about, particularly just in general, thinking about how we have our policing systems and thinking about what it looks like to show up with a more care-based approach. Using mental health professionals, nonviolent opportunities, because often, especially for our Black and Brown young people and older people, there is deep trauma and deep fear of these systems, and showing up to someone's house who's having a mental health issue with a gun is not going to help de-escalate. It often escalates the situation. So that's another space where I find a lot of concern in the community.
Absolutely, Dawn. Thank you for lifting that too. I think it's so important we're seeing ourselves in the leaders that we have, whether that be within police systems or as well as nonprofits. Thank you for lifting that.
Yeah.
Sharron, Maggie, what are you all witnessing within your community spaces and nonprofits?
Yeah, thanks. So we are seeing widespread racial and economic discrimination right now with the people that we're serving related to housing, kind of similar vein. But where we see it is more about source of income. So people, if they have a housing voucher or they have a subsidy, or if they have an eviction history, those discrimination and equities create a significant barrier to achieving stable housing. And it prevents, our people and individuals from reaching those important milestones like security, employment, improved health outcomes. I know there's a lot of advocacy work happening right now. They're trying to add source of income to the Elliott Larson Civil Rights Act, so that will reduce that discrimination. And then if there is discrimination, people can file a report with the Michigan Department of Civil Rights. That's still ongoing. Similarly, there's work going around expunging certain eviction records. So the bill will help reduce instances of discrimination. It's going to be a critical step to help people who are trying to rebuild their lives and re-enter, stable housing. From an internal space, I think as an employer, a lot of what we're seeing is inequity around Black maternal health care. I know that United Way had that as part of their equity challenge. It's so important. CHN is seeing it firsthand with both our employees and the people that we're serving. So I really think it's making sure that our employers are looking at their benefits, making sure that they're equitable and inclusive, but also how are we educating our employees? How are we making sure that our staff understand their access to healthcare and advocating again for equitable access to reproductive health care from an employee standpoint. I think one last thing as a nonprofit that we are struggling with a little bit is fair and equitable pay. CHN has spent a lot of time over the last year assessing our benefits and our pay and looking at what changes that we can make internally. And we really have been able to make a lot of really positive change, but without increased funding, we're only able to make so many changes. As a nonprofit, we're primarily funded through state and federal grants. So a lot of our grants, they only fund the services or the people we serve, which is great, but it doesn't include the staffing dollars that support the work that we're doing. For us, one of our funders, we haven't received an economic increase in over 20 years. So as staffing costs and cost of living increase, and I see shaking of heads and nodding, I know a lot of other nonprofits are really struggling with this, right? Like, how do we have a fair, equitable, marketable living housing wage that we can provide to our employees? Especially in the housing industry, we have a responsibility to make sure that our employees don't end up in the same housing crisis as the people that we're serving. So I think those are some important issues that we're really working with right now.
That's huge, Maggie. Thank you so much.
Hey everybody, just to chime in, I think they covered a lot, and thank you, Maggie, for bringing up the inadequacies with the payments and compensation and things like that. With the sexual assault work that we do here, one of the big barriers for us is always access to resources and the understanding of what resources need to be. I think that you all touched on that earlier, where I think there needs to be more representation from the communities that we actually serve in decision-making seats. And I'm not saying just as executive directors, where we are absolutely missing a lot of people of color and people who service their communities in those positions, but also in policy making. A lot of times we get mad at how things are, and we're mad at the people that enforce, but the real problem is at the level of policy. So when people are saying what grants are needed and what things are required to receive these fundings and how these fundings should be distributed, why not have the people who actually do the work tell you? I'm also the board of directors at the Ruth Ellis Center, and I try to be very engaged with the staff because you all actually do the work. So I need to hear from you in order to know what we need to do here. And I think things can just move a lot more smoothly when we have everybody at the table and we're very inclusive of the voices and the people that actually do the work, in addition to the people that have the funds, right? Because we all need one another. But sometimes we have it where the people who supply the funds get to make all of the decisions and they aren't doing the work, so they don't really know. So I think creating space for that, but definitely having conversations with the justice system. For us, where a lot of laws are in place, and for us, when we go to court and we try to advocate for our clients, the judges and the justice system aren't receiving trainings, so they don't understand about trauma and how trauma happens, and they also don't understand secondary trauma and the vicarious trauma and things like that. And so I just think that mandatory trainings for lawmakers, mandatory trainings for medical personnel, mandatory trainings for the judicial system, because these are the people who, speak for everybody and get to make laws and implement laws, right? So why are they not required to have the same trainings and everything too? I just think community wise, everybody working together is what we need. And that's what we need to do. And as far as like benefits for us, absolutely. For the people that do the work, I feel like, for people in my position who actually go out and we do first respond cases, we don't have first responder benefits. And so therefore we still have to pay higher car insurances and wear and tear on our cars and things. But at the end of the day, please know and believe that the people who work at nonprofits, we're not doing it for money. We're doing it because we actually care. But I think in that regard, we're asking, can we just have a little bit more increase so that we can function and stay healthy and positive to service the people that we're supposed to service.
Yes, absolutely, Sharron. Thank you so much. I really hear you talking about like the value of having community members involved in decision making. And I think it's so important too that we're creating that space and also providing value of that feedback as well, right? So it holds as much value of community members and of leadership. Thank you for sharing that.
Mhm.
So I'm hearing a lot of passion too when you all talk about these injustices, inequities, and I can see it that you all embrace your authentic selves, your values, your identities, your intersectionalities. How do you go about that in professional work or like within your work, even in the community too?
So for CHN, we focus a lot of time and effort on our DE&I and wellness engagement activities, really to create that space for people to connect and build relationships. We also try to model this from the top down. So we're all unique. We all have our own histories and lived experience, and bringing that authentically to the workplace is super important for both me and CHN. Sharron mentioned we're not necessarily doing this for the money, right? We're doing this because of the passion and our commitment to work. CHN's been doing a series on why. why do people work at CHN? Why do we keep doing this work? Most of the stories that are being shared from our staff, or even people like myself and other members of our executive team, we all have our own lived experience, either with homelessness or mental health struggles or disability or poverty. So by sharing these stories, I think we're really able to show, one, that we're all human, and it really doesn't matter what title you have or what role you fill, that we all have a place at CHN. And I think it's critical to, for me at least, that bringing that authenticity and understanding to CHN is what I try to do every day.
I love that, Maggie. So not only showing up yourself as yourself and your values, your identity, and also making space for your staff to do that as well.
I think,
Sharron, I saw you.
yeah, I think doing DEI work, and it's really weird because I have nerd moments when I talk to other DEI professionals. And we can really tell how passionate we are. One of the things that I always say is I didn't go through everything that I went through for nothing. I'm very intersectional. If you know me personally, you really know how intersectional I am. Experienced a lot of things, but here I am on the other side of it, and I can really talk to people about that. And so I know how uncomfortable it has been to be in spaces where you are judged and all of these types of things. And I've learned to manage to overcome that and find my way and be a little bit more comfortable. And in my positions and with my platform, it's a privilege for me to be able to create spaces for people to feel the same. I just know that sometimes uncomfortable conversations create change, and I'm not afraid to have them. And so I just use my voice to try to make sure that everybody finds a level of comfort, because when we do that, we actually perform better. If I'm allowed to be my authentic self, my performance level goes up, which means that my organization's performance level is going to go up. So just imagine when we all allow ourselves to just be ourselves and support each other individually, how great our organizations can be.
Yeah, I mean, I hear, I'm gonna uplift what Sharon just said. This idea of showing up just in our authentic selves is part of how I embrace it. I am someone who holds multiple multiple marginalized identities myself, and I am pretty vocal in those spaces. I'm not one to like avoid the conversation. I think that sometimes conflict can be really productive. And as you said, sometimes it is requiring and asking of people to get a little uncomfortable. Because ultimately, if you stay guarded, if you stay, particularly those who are part of the privileged identities, when those folks stay guarded, they're not really allowing for a lot of new information in. One of the things that was mentioned in this is talking about embracing your own values. And for me, that's something that has been really critical in my whole professional journey, is wanting to be in a place where my personal values are in alignment and complement the values of an organization that I'm working with. I really highly value the idea of integrity. And for me, that looks like, did I do things today that allow for me to put my head on my pillow tonight? Right? Can I fall asleep with this? And so every day I am aware of my decisions and my choices, and the folks I work with, knowing that I'm going to have to live with what I do and the choices I make, and I want to be able to fall asleep at night, right? And so oftentimes it's my values that become a decision-making filter for me. And I'm fortunate to and privileged enough to have gone through some different spaces in order to find organizations that really allow for me to live in my own values, in partnership with the organizational ones.
Thank you so much. That's challenging to find too sometimes. And so it's really important that we have leaders, especially you all here, like making space for that within our organizations for people to show up and to live in their values, right? And to work in their values. So thank you for speaking to that, Dawn. And I'm hearing a lot about, what we do in the workplace, how we show up as ourselves and live in our values. And I'm curious about any success that you all have seen. What best practices have you seen within your work and your organization when it comes to DEI and belonging issues or strategies, really?
I've seen the more brave organizations are the ones that seem to flourish the best. Again, uncomfortable conversations create change, so we have to be willing to be uncomfortable if we want to embrace change. So here at Avalon, I mean, I have to give hats off to Kim Hurst, our founder and executive director, because I actually approached her with the idea of DEI in a nonprofit, which is, I don't know how common that is, but she embraced the idea. And honestly, this is our second year in developing this program. And it's a bit challenging, but when we really sit down and look at, how we've progressed, it's been great. So I think for one, as Maggie mentioned earlier, just buy-in from the top. DEI work and inclusion and things like that are not going to work unless the top people are on board. They have to be on board. They have to go through the work too. And it's really a tear down of you to really understand yourself and things that you need to work on, right? So it's really a cleansing thing that happens. And then in addition to the DAI champion, you have to get your staff on board, and everything like that, so that we can all be on the same page. In addition to that, we've implemented ERGs for our employees here. We have a survivor advisory council to make sure that our survivors have a voice in the decision making that goes on. Pretty proud of myself. We actually have a DEI committee, which is comprised of the different disciplines within the organization. And the great part about it is, right, this is our second year having the committee. Everybody wanted to stay. And then we had new people who aren't as vocal sometimes in our organization actually want to join too. So what it means here is that we actually see that everybody wants to participate. We have very uncomfortable and hard conversations, but it's actually working and staff is engaged in it and staff is excited about it to the point where even celebrating one another, and it's Pride Month. And so all of the allies were, I think, more excited than the actual LGBTQ members here. But as somebody who's implementing that program, it really warms my heart to see that everybody's so receptive and supportive of one another. And I think sometimes I get a bit cranky around the office because, it's a lot of work to put in and make sure that everybody's smiling. And by the time they're smiling, I want to take a nap. But it makes you feel so good just to see that the staff is supportive of it, and it also trickles down to our clients. So now when our clients come in, they can feel that change and they can feel that support too, just based off of our DEI efforts that we're working on internally, to be able to reflect that outside.
Thank you so much, Sharron. I'm curious too. We got a question in the chat. What is a ERG? And can you talk a little bit more about how DEI works into that?
Okay. So the ERGs is just employee resource groups. Avalon Healing Center, as was mentioned before, we work in sexual trauma, right? So we have, I mean, some people may be primary, secondary, and vicarious trauma. Very, very, very hard work. And we can say, well, we have benefits and you can go talk to someone, but we can also put things in place internally to where it can relieve staff of some stresses, or it can make people who have common interests get together and not just talk about work, but also get to know one another. So our ERGs, our employee resource groups, are a little bit different than what you may typically hear. We've let staff pick those according to their interests. So we have healthy living ERGs, we have writing ERGs. We're just trying to also find other ways for our staff to be able to release, just like we offer to our clients. When you're doing this work, you have to realize that we are experiencing the same things. And so the things that we want to see our clients, we want to see them grow and we want to see them have opportunities. We also need to love on our staff as well. And so the ERGs is just a small thing that we can do here that where you can, while you're working in your workday, actually go and take a break and talk to people that you work with to learn other things about them too, right? Because all we talk about is work within our organizations and what we do here. But when we really start to have conversations with each other, we realize that we have so many other like talents and skills and passions that can just be poured into too. But rarely do employers create space for us to be creative and adventurous like that. We just focus on the work, the work, the work. And then this is a whole nother discussion, but then that leads to the fatigue and the burnout, and we want more retention, right? And so since we're here and we can have these conversations, we can talk about things that we need about ERGs, and we need space for people inside of these organizations to breathe and not feel like they're going to get fired because they need a moment, because they feel, because of the work that we do is so intense and heavy, that sometimes we feel too. And I don't want to feel like I'm going to be punished because I've had a hard case with a client and I just can't do it today and I need to go home and regroup so that I can be fresh for my new clients tomorrow, right? So we need to create safe spaces in these types of institutions, in these types of jobs, for people to be able to feel safe and be able to do expression and be themselves in that space. Sorry, my voice is leaving. I hope that I answered the question. If I did
You
now,
absolutely did. Yeah, thank you so much, Sharron. I really love how you talk about embracing conflict and discomfort too. And I can see you're doing that with the ERGs as well. So thank you for sharing that.
Yeah, I feel like I'm in a very unique and special position with the work I do. At N.E.W, we actually provide services to support other nonprofits and mission-driven organizations in gaining capacity. Maggie, when you were talking about funding earlier, I thought about because oftentimes people get funding for a program, but not to serve the program or employ people to run the program. And so what we often do at N.E.W is related to those capacity building dollars. We will support an organization in building out practices to support equity and inclusion and creating a opportunity, what we often talk about as a culture of belonging. Where it is about making or creating a space where people feel like they belong. Oftentimes the issue is the othering that occurs, that seeing yourself not as part of the same community. Here at N.E.W, I'm very lucky. I wouldn't say we use best practices because I don't like to use that language because I don't think there is one right way. However, we are constantly, I think, in the nature of what we do, shifting and evaluating and reevaluating our practices. One, because we care about that for our own team, but also because of the work I'm doing in consulting. I want to make sure I know how to best serve other folks. Ultimately, here we really have a lot of transparent decision making. I think having transparent decision making is important, particularly in the sense that it kind of breaks down those hierarchies. You can name what type of decision it is. Is it a situation where we're looking for consensus or consent, or is it a decision that is going to get opinions from folks, but ultimately the leader of the organization is going to make that decision? When you are transparent and direct in those ways, it allows for people to feel seen and to know that they are part of the conversation. We also talk about, here at N.E.W, we have participatory budgeting. So we're really doing things in a way that really invests everyone in the organization in the outcomes of the organization. We also have flexible time off, so it's actually unlimited. And we allow for folks to name when they need that. So there is a number of different practices within our organization that have really expanded our equity practices. We have an organization or group called Culture Cultivators within our org. And again, it's an opportunity to bring together people from across the organization, both like up and down, hierarchical and lateral. So we want to make sure there's representation from everybody in the organization. And often when we're doing work with a client, we name that as well. We say, like, we don't want to just talk to the leaders. Yes, we want someone from the board in the room, but we also want a direct care worker in the room, because you can't make decisions that are going to impact people without including them, right? And I always go back to that nothing about us without us concept. And I believe that shows up a lot in my organization. And that is definitely what I bring to others when I'm doing that consulting work, is having a deeper conversation about how can you get this organizational shared leadership, shared ownership of what's going on.
Absolutely. Thank you, Dawn. I heard you say participatory budgeting. Can you talk a little bit more about that? Like, I can hear that it's really about bringing folks together and making sure there's space in the room, but what does that process look like for you all?
I will say it's not always the easiest process, right?
Yeah.
But ultimately, we hold a staff summit every year where we talk about what our budget looked like for the previous year and prepare our budget for the upcoming year. And so our team leads are preparing our budget. We're working with the finance folk. We're also bringing that back to our full teams. So everybody is having a conversation about what is realistic and what is an option or what is possible within their workspace. We all know exactly what the budget is. We are given documents and we can check those regularly to see how much money do we have for this type of thing? How much money are we spending on salaries? And so it puts us in a position where there isn't ever a question. I think a lot of people, when you think about something like unlimited PTO, worry that people will take advantage of it. Well, I think in having everyone engage in budget work, right, engage in these other practices, there's a recognition of, sure, I can take time off, but what does that do to our organization, right? And so everybody has a investment in a way. We also do cost of living raises in a way that essentially allows for folks to identify if they need more or they need less than others. So that way we can try to create some equity in our pay over time. And again, it's something that you would expect to be contentious and really difficult to meet, but we have actually had a lot of success there. In fact, we ended up with a somewhat of a surplus after this year is because there were a lot of folks who were like, we're good. And we're happy with our salaries, right?
Wow.
So yeah, it's been very encouraging to watch entire organization be invested in how we're showing up and how we're operating.
Absolutely. That is incredible. Thank you, Dawn, for sharing that. Maggie, would you like to jump in too? How have you embraced best practices or initiatives in your org?
Sure. So every year we do go through a strategic planning process, and that includes all of our directors, sometimes our board. We identify the initiatives for the next year. We always focus on diversity, equity, inclusion to have those specific initiatives built in every year. Same with kind of the trauma-informed care component. This year we really focused a lot on education and connection. I feel like there's a lot of training, definitely employee surveys and feedback. Right now we're partnering with Marsh McLennan Agency to provide trainings around practicing empathy, unconscious bias, microaggressions. What we find really impactful is using small group formats that we can get really good conversations going so that the training not only teaches content, but it's also creating that sense of belonging and shared experience as people are going through these things. We do have an amazing long-standing, we have a DE&I, an accessibility and wellness committee. So these committees do great work around education and engagement with our staff. Some of this will include like, we're able to raffle off tickets or sponsor staff for events. Like we sent some to the United Way Women's Summit and our homelessness advocacy day out in Lansing. Or we're able to get museum tickets so staff can continue to get educated or learn, historical information. Back to what was said earlier, I really think that not shying away from those difficult conversations is imperative. I know I'm still learning. I know that as an organization, we're still learning, right? So there's so much out there that we can learn, understand, and improve on. So I think one of the biggest things that CHN does is making sure that we bring in experts to get that outside perspective, right? So for example, we screened the housing portion of the race movie, and then we had an expert-led discussion around race and racial discrimination in housing, so that it was that external kind of safe space. It wasn't just the leadership leading it or one specific staff. We've also had Jaleesa Abad from Fair Michigan and Susan Crocker and Rachel Crandall Crocker from Transgender Michigan provide lunch and learn sessions with our staff. It helps us look at how we're creating inclusion as an organization, but then also how do we better assist the people that we're serving, especially in those situations, those specific lunch and learns, people who are part of the LGBTQ plus community. So we've also expanded our services. I know Affirmations, the Ruth Ellis Center, Full Circle, Shepherd House, because we want to make sure that we are providing services to the LGBTQ plus community and even the people in our aging community, and not, talk about those intersectionalities with homelessness. I'm going to toot our own horn a little bit. We've been doing some really great work around reducing barriers. Our PATH team, which is Transition from Homelessness, they go out and do street outreach every day. What they've been doing lately is starting to bring other service providers with them when they do that outreach to reduce the barriers and then create a bridge between housing services, but other critical health related services. So we struggled a lot with how do we get the people to these other places? But that initiative of bringing them all to the person has been very successful. And we're starting to see some really great outcomes from that. I feel like we do a lot, but I also feel like there's so much more to do. It's definitely an ongoing process for CHN.
Sorry, I couldn't find the unmute button. Thank you so much, Maggie. That is also really important, and I really liked how you talked about bringing other service providers with you to do that street outreach, and that's really incredible, like a collaboration to care for community. Thank you for sharing that. And that kind of leads me into our next question, which is what can we do as a collaborative here together? I know that this was something we talked about when we were brainstorming this panel, is how do we do this? How do we work towards equity together as a collective?
Oh yeah, I really appreciate that segue that Maggie was talking about, because I oftentimes am preaching collaboration and cooperation between nonprofits. I think often the funding cycles put people in competition, and it's difficult to challenge that. And what I often will think about is, if there is a funding opportunity, a grant opportunity, what does it look like to partner with an organization who is doing similar work? Because you ultimately have the same goal, right? You are invested in serving the community. And so what is it that you all can do together, rather than say, well, ours is going to be better and this is what distinguishes what we do compared to what they're doing? Reality is that the community needs both. And there are so many nonprofits in Michigan. So to think that you're the only one doing the thing is just false. And so there's an opportunity to build relationships. I'm really passionate about those opportunities to do even like collective conversations, things like this, where it's bringing other organizations together, meeting and learning more about people's services, so you can think about these collaborations. I also think that there's an opportunity to think about what advocacy work we can do as a collective. Myself and others mentioned different things about policy related to the carceral system, housing. I think there's a lot of red tape that exists. Oftentimes the qualification, for example, who's homeless and who's not, is a very almost cutthroat situation, right? And you are put in a position where like one day you qualify for services, the next you don't. And I think that there is a lot of advocacy work that we can do as a collective in the nonprofit community to challenge those assessments even, or the access, like the ways that people get to access services, and even going as far as like challenging what maybe is being put forward by HUD or the Department of Ed, right? I think that as a collective, we have a lot of power. And when we work together, that's heard. There are so many of us. So that is where I think about how we can work together.
I think that we just did a United Nations panel not too long ago, and I think the conversation was overwhelming for everybody. I think we need to shrink down the problems. I think sometimes we make them so much bigger. than what they are. Not to say that they aren't big. They are big. They are huge. But we also have things like technology. And what I reminded them is we are in several different countries, but having a whole conversation with no interruptions and discussing the issues within those spaces. So let's not be intimidated by how big the problems are, but just realize that things that we implement today, us personally, we may not see change, but we also have to remember that people have worked to get to where we are to help us further our cause. So we have to shrink down the problem, I think, and really just work together and say, what is it that I can do? Look at the resources and the people that you have and the connections that you have, and just take small steps. Realizing that it may not happen today, but another thing that we do in the community, and especially in the community now that I'm getting older, I don't see enough of us mentoring. There are a lot of young, passionate people that want to do the work that we do, and we're so consumed with what we do and our plans and what we want to happen that we don't take time to nurture and embrace these babies that are coming up that are going to take our place, that can actually carry on the things that we're trying to do and make our legacy stronger. I think that we really need to look at the resources that we have. And to your point, what is it that you all do that we don't do, and we can work together and do the same thing? Avalon got this space specifically for that reason. So we have partner rooms and training rooms and everything where we actually engage with, invite other organizations into our space, and we really sit down and hammer out these different ideas and come together. So if this is a discussion that we're all having, and I know, excuse me, Shayla, that we've been talking about this, but this is absolutely something that we're willing to offer here too. So we don't want to stop the conversations. We just want to add on to the conversations and just, work with different partners and build on what we're building on already.
That's great. I've really loved being part of this panel today. I've learned a lot, but I also feel like we're all doing such hard, similar work. I think, Sharron, you brought up that ERG. It's very specific, but I would love to see that at the employer, the leadership organization level. I think so many of our staff are doing very important but very heavy work. We talked about that. It creates burnout. It's hard to process sometimes, especially if staff are coming, with their own lived experience. But how can we as organizations start to partner together to share the resources that we're providing our staff? Not only the people that we're serving, but like, how do we look internal? Am I doing something with my staff and using resources that you would also benefit from? I think that would be a huge successful collaboration in this employment kind of time period that we're all sitting in right now. I know we definitely can't do it alone. It's going to take collaboration and teamwork, and we do have strong community partner relationships. But I think even looking beyond, okay, we're both working on housing, so how are we collaborating with providing services to the people, but how can we connect together on that bigger view?
Yeah, thank you so much, all three of you. I have learned so much today as well, Maggie. And what I'm hearing you all say, like that answer is embracing that abundance mindset, and not thinking about the scarcity that exists, or that we're kind of forced into, and collectively organize, right? Like to tackle those large problems that we're seeing. So thank you all so much.
I also wanted to add, we were talking a lot about, we brought in DEI committees and things like this. And part of the way that we can really collectively work together is thinking about how DEI is not a separate initiative, right? There should be thoughts around equity in every aspect of the work, whether it's the employee experience or HR, finance, IT. There are opportunities to think about how you can do each and every aspect of the work in equitable ways. And so I think oftentimes it gets put into, okay, this is the DEI work we're doing, and here is the financial work we're doing. And the reality is that it all needs to be in connection. And I think when you can start doing that, you start seeing how you can engage in equity and end up with a more just organization overall that it's able to serve people in a better way. And so I just wanted to add that in, because I think that's always a misgiving, is like people will be like, yes, let's do DEI. And then it's over
Yes.
here. And then they're doing strategic planning over here. And I'm like, please include DEI in the strategic plan.
Yes.
So
Yes.
I think that's part of the way that we collaborate together and work towards equity.
Thank you so much, Dawn. I could not wrap us up on a better note. Thank you so much for adding that. And thank you, all of you, for being here and being such incredible leaders. Someone said in the chat, like, I look up to you all, and I know our community certainly looks up to you all as well. So thank you. I am going to wrap us up. Yes, thank you. And I do have a few more updates for our audience before we're done. So as a reminder for anyone in our community who may be experiencing a need, our 211 helpline remains available 24 hours a day, 7 days a week. This includes resources like food, utility assistance, and much more. We always maintain a running list of available services in the community and can connect you to the support that you need. You can also look up resources in your area by using our 211 resource database at unitedwaysem.org/211. Are you ready to rise to the challenge after hearing this incredible panel and create a more equitable future? Please join us for United Way for Southeastern Michigan's 4th annual 21-day equity challenge. To sign up for this year's challenge, please visit unitedwaysem.org/equity challenge. And lastly, our next town hall next week, we will continue our Equity Challenge series with a Birth Equity Town Hall as we learn more about current and future doula care in prisons. Tetta and Kara will join us from the Michigan Prison Doula Initiative to share more about their important work they're doing in Michigan prisons. To stay updated on our upcoming topics and watch replays of previous town halls, please visit unitedwaysem.org/virtual town halls. Thank you so much, everyone. Stay cool and continue to live united.